Welcome back. Heart failure affects nearly 6 million Americans, but a new treatment involving a tiny device is showing promise for heart patients and their families. Dr. Paul Saraja from the Hedrick Valve Science Center at the Minneapolis Heart Institute participated in the study. This is a big deal, you're saying, because so many people are affected by this.
Yeah, it's quite remarkable because right now there are about 3 million people in the United States alone who have an enlarged heart with heart failure and a leaky mitral valve, also known as mitral regurgitation.
And so this is the device you're speaking of.
It is. This is a device. It's a relatively new device. It's minimally invasive. It's designed to go through the leg of a patient and be passed up to the heart.
Okay.
And it's designed to put the leaflets of that leaky valve back together with a small clip. And this is the actual size of the device.
Wow, it's fascinating what we can do anymore, isn't it? So what's the big takeaway from this, though?
Well, the most amazing thing is that we haven't known until recently that treatment of these leaky valves in patients with enlarged hearts was of any significant benefit. But what we learned just in the past month is that treatment of these leaky valves actually not only improves symptoms, but it saves lives and it keeps patients out of the hospital. In fact, it improved the survival by 40% in the study.
That's huge.
Yeah.
And so what you did was you enrolled some of your patients in the study. That's how you got involved,
We
right?
did. We were a participating site among many other sites across the country, and it was a great study. It was rigorous, challenging to enroll, but we got it done, and the results have just been miraculous.
So what happens now? If someone's sitting at home and they know somebody or they themselves are affected by this, do they go to their doctor? What do they ask about?
Well, some of the challenges are that the symptoms of heart failure or symptoms related to these leaky valves don't resemble necessarily that of a heart attack.
Okay.
So
they may not even know.
That's correct. They can be just simple shortness of breath, fatigue, swelling of the legs, and it can resemble other disorders like lung disease, and so it can be hard to distinguish. But the most important thing is those symptoms can signify something that's life-threatening, and if one has this, one should seek care.
Go to your doctor and talk about it.
Yeah.
Ask about it. Doctor, thank you so much for being here.
Thank you
we
for
really
having
appreciate it. Very cool. We do have more information about the MitraClip. Am I saying that right?
MitraClip is right.
MitraClip.
Yes.
It can be found at care11.com.